Good evening, everybody, and thank you for joining our presentation this evening on the UCD MSc in Clinical Nutrition and Dietetics programme as part of UCD's Masters Week. I'll be joined this evening by Dr. Sarah Browne, who will provide a short presentation on the MSc programme. We will then be joined by two recent graduates, Natalie and Porrick, whom I will introduce when Sarah has finished her presentation. There's no need to write notes, as the presentation will be available on the website of the School of Public Health, Physiotherapy and Sports Science in a few days' time. But please put any questions that you have into the Q&A and we will do our very best to answer them. Can I introduce you now to Dr. Sarah Browne? Sarah is a core registered dietitian and she is the Programme Director for the MSc in Clinical Nutrition and Dietetics. Sarah worked in both community and private practice dietetics before joining UCD. She undertook her PhD studies on adolescent nutrition and physical activity, and she is internationally recognised for her ongoing expertise on integrating sustainable food systems into nutrition and dietetics education. So I'll hand over to Sarah now. Thank you, Sarah.
Thanks so much, Claire. Good evening, everybody. So as Claire said, I'm going to take you through a short overview of Masters in Clinical Nutrition and Dietetics. So it was actually the first postgraduate program for dietetics that was set up in Ireland almost 10 years ago now, and set up by Professor Clare Corish herself. It's a 2-year full-time taught program, and our students start in January. And we offer in and around 24 places per year at the moment. The application process opens in February and it closes in June. So that is the point at which you apply for the program. The applications are reviewed in July and our places are offered out thereafter. It is a program that's recognised and approved by CARU, and CARU is our state registration board for health and social care professionals in Ireland. So our graduates are entitled, once they graduate, to apply for registration as a registered dietitian in Ireland. So firstly, and very briefly, what are dietitians? Well, dietitian and the term dietitian is a protected title in Ireland, and they are the only nutrition professionals who are statutorily regulated and governed by an ethical code, just to ensure that they always work to the highest standard. So dietitians assess, treat dietary and nutritional problems with individuals and apply skills to many other domains, such as the community area, health promotion, and public health levels as well. So in that sense, it's a really well-rounded professional qualification. We focus on evidence and use the most up-to-date public health and scientific research on food, health, and disease. And dietitians are particularly skillful in translating nutrition science and information into practical guidance for communities and individuals, so that they are empowered and supported to have healthy, sustainable diets and food behaviours. So the INDI, or the Irish Nutrition and Dietetic Institute, are our professional body in Ireland and support continuous professional development in professional matters. And CARU, as I said, are the state regulator. So on to the application process then. There are 4 broad areas that you need to ensure you've covered when you want to put in an application. First of all, you need evidence of your academic background through your transcripts from either both an undergraduate degree or, if you have one, a postgraduate degree, but at a minimum an undergraduate degree. We do require a first or a 2-1 level degree at undergrad or postgraduate level. In addition to this, you need to submit a professional CV with your academic and work experience history, and as well as that, a personal statement. So I'll go into more detail in the personal statement in the next slide. And we also require at least 2 relevant reference letters. I suppose I should say that if any elements of the application are missing, we generally don't review that application because we don't have all of the information that we need to make an assessment on an applicant. So for the criteria that we use to assess an application includes the academic prerequisites. So first of all, we need to ascertain, does someone have the prerequisites that are required? And in this case, it's essential that you have biochemistry and physiology from your previous degrees, and have sufficient amounts of those, what we would consider around 10 ECTS or 10 academic credits. And this needs to be evidenced in your academic transcripts. The communication skills need to be demonstrated at various points in your application. That can be done through your personal statement, your CV, and evidence on your reference letters. And we look for both evidence of strong oral and written communication skills. We generally don't do interviews, but we reserve the right to do so if necessary. The motivation and interest can be conveyed in your application through your professional CV. So evidence that you have experience or insight into nutrition and clinical dietetics. You can also obviously convey this in your personal statement. There can be misconceptions about what a dietitian does in practice, and it's really important that your application conveys an understanding of that. We also like to see, because it's a competitive process, we like to see that people have sought out information about dietetics, such as talking to dietitians in the field, undertaking shadowing if possible with a dietitian, working in a healthcare setting, such as a healthcare assistant, or volunteering with a vulnerable group that have healthcare needs, nursing homes, things like that. There's various ways to build up, I suppose, that level of experience that can strengthen an application. In addition, then your 2 reference letters are assessed, and I suppose what we're really looking for here is evidence of professionalism, communication. So, if you have worked with someone, either an academic supervisor or an employer, and specifically used strong communication skills, both oral and written, that is conveyed in the reference letter, and that allows us to assess that criterion. They can also obviously point to your academic record and your academic skills, and also the knowledge and skills that you've developed with them, evidence of teamwork and transferable skills that you can bring to the dietetic profession in our program. So now I'm going to take you through the structure of the program as it stands at the moment. So as I said, we're a January start. So when you come in, and in January, you are involved in a taught semester, and you undertake 35 ECTS or credits, academic credits. There are 3 core modules that you must take in the first semester: Dietetics Through the Life Cycle, Medicine for Clinical Nutrition and Dietetics, and Dietetics Professional Practice 1. And then you choose from 2 of 4 options. So these are our optional modules here in yellow. You then have a free summer as such, and then you come back for placement in autumn of year 1. In year 2, then your academic semester starts again in January, and it runs till the end of March, early April. That's a shorter semester, and you undertake 25 ECTS or 25 credits. And the reason it's shorter is that you need to be going out on your second placement in early April. So the core modules there are Advanced Clinical Nutrition and Dietetics and Dietetics Professional Practice 2. And here you take one of 4 optional modules. So some of them would have been offered in year 1, but if you haven't taken them, you have an opportunity to take them this time around. And we have an additional module here on nutrition epidemiology and exercise prescription. So as I said, there's placements both in year 1 and year 2, and you are required to undertake 1,000 hours of mandatory practice placement or practice placement education. And in total, that's 60 ECTS or 60 credits, 30 for each of those placements. This is a requirement of Peru registration, and you need to evidence that at the end of the program that you've completed those hours. So in September to December of year 1, you undertake 3 days of pre-placement and then 14 weeks of mixed dietetic site placements. You also undertake 2 weeks of food service placement or catering placement with a project in this as part of this mix. So you'll see that people go to community dietetics. They will get to see some long stay residential site hospitals. They can also go to smaller hospitals and acute clinical sites as well as that. Then in year 2, there's another 14-week placement. And the focus here is really on the acute clinical patient care, so more advanced clinical dietetic skills in teaching hospitals. And that takes place between April and July. Again, 14 weeks with 1 week of replacement. The placements are very much supported by our specialist lecturers or clinical tutors. So these are staff members on our team who are specifically assigned to support practice placement. And they also train practice educators at our sites. So students are very well supported during practice education. The final module of the whole program happens in the autumn trimester of second year, and that is our dissertation module. That is a full-time dissertation module where students for 12 weeks are engaged with a research project. We have some really nice partnerships with clinical, public health, food safety, and other nutrition and food related bodies in Ireland. And they suggest projects and research to us and our students, and there's really nice partnerships and collaborations that go on. So students get excellent experience in undertaking food, nutrition and dietetic related research, and they have great opportunities to develop their research skills and also communicating their research at national conferences. So there's been some lovely outputs from this research over the years, and some brilliant collaborations with our sites. As part of practice placement, there are a couple of opportunities that I just wanted to mention. In year 1, students are offered the opportunity to get involved in UCD Volunteers Overseas program and undertake, if it works, some of their practice placement hours during that program. So recently, our students have been going to Uganda with physiotherapy colleagues and working in disability centres for children and their families. And that is a very rewarding experience for our students. And we have found it to be very positive in terms of contributing to their development over the course. Another opportunity for students is in their first placement, where dietetic students and physiotherapy students work together to develop Healthy Eating Active Living Week at UCD. So at UCD, we have a community of over 30,000 staff and students, and there is a health promotion week every year in November. And it is actually our students and physiotherapy students that design that program. So students begin in September exploring their ideas through design thinking processes, and they're supported by our tutors and academic staff here at our school. And they implement really innovative and interesting initiatives during Healthy Eating and Active Living Week and evaluate those. So there's huge transferable skills and personal and professional development, and a lot of collaboration with our interprofessional colleagues as well, which is really positive. So this is an excellent initiative that runs every year. So just to summarize, in year 1, you come in for your academic modules from January to May, and these are taught modules. Then September to December, practice education placement of 30 credits for 14 weeks. You come back in year 2 between January and March for more taught modules, and then April go out onto practice placement again until July. There's a short break, and then you come back in September for your dissertation module and then complete the program. We find that our graduates work in a variety of settings, but primarily in clinical settings, in both sort of hospital acute settings, in a range of medical nutrition therapy areas, but also community primary care settings as well. And that is becoming increasingly important in terms of where jobs lie within the health service as we decentralize and ensure that healthcare is closer to patients and their homes and communities. But we also have definitely the skills to transfer into policy and public health, and dietitians work in a range of areas, including within the Department of Health, Department of Agriculture, the Food Safety Authority, Safe Food, Borbia would be some national public health bodies. And then industry would have a lot of opportunities for nutrition and dietetic professionals as well. If you're interested in sports and sports nutrition, there are opportunities in that area as well. Obviously, several people will be interested in research and education. So we have lots of good dietitians in academia, and there are considerable, opportunities to get involved in the media as well, because communication of nutrition messages and counteracting misinformation is such an important part of our role. So just thank you for listening so far, and I'm going to invite Natalie and Porrick to join and invite Claire back.
Thank you very much, Sarah. There's two really short questions. If you don't mind, I'll just put those to you quickly before I introduce Natalie and Porrick. Is that okay?
Yeah.
And the first one is, Sarah, I'd like to ask how many applicants are there in general each year?
Yeah, so we would get over 100 applications, good chunk over 100, maybe 120, 130 applications per year. And as I said, we have in and around 24, 26 places. So yeah, it's a competitive application process.
Thank you. And the second other question is, can you just describe what the 3-day pre-placement is like, or what that is?
So when our students are going out in the first placement well, both placements have pre-placement weeks, but it's really our clinical tutors, specialist lecturers, preparing students for what can be very different working environments. So in pre-placement, they can do things like how do you read a medical chart? What is expected of you professionally in this setting? So it's those types of preparations that are key. And also, when students are on placement, they're required to fill out forms around reflections and how they're doing and what they're learning and how they're achieving their competencies. So those types of forms and what's expected of them would be covered in that as well.
Lovely, thank you. Now I'd like to introduce two graduates, or two recent graduates, Natalie and Porrick. So just to introduce Natalie first. Natalie's Canadian graduate from this year, 2025. And Natalie previously studied nutritional science and bioresource engineering in McGill University in Montreal. And she'll soon begin work as a dietitian in primary and integrated care. Porrick is an Irish graduate, and he previously studied nutritional sciences in UCC before he came to Dublin to UCD. And Porrick is currently working as a dietitian in Waterford University Hospital. He's also has had living with diabetes for the last 20 years, type 1 diabetes. So he's a director of a company that is called GlucoCurve Dietitian Limited, which has been set up now to provide personalized nutrition advice for people with type 1 diabetes. So thank you, Natalie and Porrick, for joining us. And if you're happy to answer a few questions, maybe I'll ask Natalie a few questions first, if that's okay, Natalie.
Yeah, of course.
So I suppose as a Canadian, what was your thinking in choosing this program in UCD?
Yeah, so for me, I picked UCD for multiple reasons. So I really like the fact that it was a 2 years master's and it was approved by Coru, leading to becoming a registered dietitian. For me, the start time in January was actually a really big factor because it just worked really well with my timeline and finishing my previous degree. So I could just go straight into this one. And then as well, a really big factor was one of my previous supervisors. She actually recommended the course. She said it was a really good course for dietetics. So I took her word for it, and it was quite a good one.
Very good. Thank you, Natalie. So I suppose maybe what advice would you give then to students who are coming from overseas, who are thinking about applying for and doing this particular master's program?
Yeah, so I guess the first thing would just be to be very prepared and organized. There's a lot of things that you need, especially for placement and stuff like vaccination records and background checks and those type of things. So they're a lot easier to start or gather when you're back home than rather trying to get things while you're here. It just makes it more difficult, and you have other things that you need to be focusing on as well. And then also it's like not to be afraid to reach out when you need help or support, because like the program is a lot of work to begin with, and having to move overseas can kind of create its own challenges. But everyone in the program is very nice and very supportive. So it's like you don't have to be afraid for asking if you need a little support. People will be more than happy to help you and definitely point you in the right direction.
Super. Thank you, Natalie. And finally, what did you think of or enjoy most about the UCD campus?
Yeah, I actually really liked the campus. I thought it was quite nice. It's very, very spacious, which is positives and negatives. Can take you a while to get across the campus, but it is really lovely, especially like the pond in the middle where all the swans and other birds are. It's a great place to sit outside, eat lunch when it's a nice sunny day. There's also a lot of nice little cafes with good coffees all throughout campus, and as well, there's a lot of nice spots like in the library and stuff to study, or there's the gym or the movie theater too if you need like a spot to relax in.
Lovely. Okay, thank you, Natalie. So, Porrick, if you don't mind, if I ask you a few questions as well.
Yeah.
So, the first one is really like, what was your favorite part of this program?
Yeah, there's loads of different parts to pick from, I suppose, like the clinical experience and when you go out in placement and just having the oversight of a qualified dietitian was brilliant. Um Getting to learn with like-minded people like your classmates and building a bond with them was brilliant as well. The campus, as Natalie was saying, and then like the shared project with the physiotherapist students in Heal Week, that was brilliant. But I think that my favorite part personally was getting to hear from so many guest lecturers that were specialists in different areas. Like there's such an array of different areas. So like bariatric surgery, nutrigenetics, private dietetics, loads of different places like performance nutrition as well. And I suppose just when you hear from somebody who's so interested in a particular area, I suppose they get their point across really well, and it's just made our learning as the students really easy then, and I suppose it sparked interest in different areas for different people as well. So I thought that was probably my favorite part of the masters.
Super. Thanks, Porrick. So, I suppose, what aspects then did you find most challenging in the program?
Um, Initially, I think the going into the masters, because you naturally have an interest in nutrition, you might have some preconceived ideas that might not be evidence based. And because the masters is based around scientific research and what is evidence based, you kind of sometimes have to let go of those ideas that you might have had before. But I suppose that turns into one of your biggest skills as a dietitian when you do qualify is using the evidence base. So that was challenging. And then as Natalie said as well, it is quite a lot of work in the 2 years. So you definitely have to be prepared and organized. It is a challenge, like the placements in particular. It's your first time going out and being in a professional environment where you're kind of patient facing. So you have to just be prepared mentally for that kind of scenario.
Excellent. And then finally, Porrick, do you want to tell our audience or the people who've joined us a little bit about what you've been doing since you finished?
Yeah, I was lucky enough. It was probably we finished Christmas last year, and I was working in Waterford Hospital on the 6th of January, so I got straight into to clinical work. I'm still in Waterford now. I'm working on a couple of different wards. I've been rotating around, so I started in orthopedics, and that was great, and general medicine, and now I'm on a stroke ward with a bit of neurology as well, and then general medicine, and I'm going to be rotating into pediatric diabetes then as well. So that's what I'm doing as my 9 to 5. And I suppose one of the reasons I went for the masters was I always wanted to work with other people with type 1 diabetes because I have a personal background in that as well. So I've set up GlucoCurve, which is a virtual service for people with type 1 diabetes. So I've only launched it in the last couple of months, so it's in its infancy, but I have an Instagram page and I'm working on setting up a website as well. So they're just some of the opportunities that you get from the masters. So who knows where that'll go, but yeah, that's what I'm doing at the moment anyway.
Lovely. That's brilliant. Thank you, Porrick, and good
No
luck with that.
problem.
It's
Thanks very
well
much.
needed. So, Sarah, if I could address a few other queries that have come in to you, if you don't mind. Must my current job align, or as long as I have relevant experience, if I've relevant experience? So, somebody, for example, with a bachelor's in food science and nutrition.
Yeah, so food science and nutrition, you need to be sure that you have the prerequisites. So definitely to ensure that you have enough physiology, 10 credits of physiology needs to be demonstrated. And if that isn't in your food science degree, then you need to find a way to produce that and show the transcripts of that by taking extra modules that are required. At the same time, you're still within the same competitive process as other applicants, and we do get a lot of applicants who would have a nutrition science or a human nutrition degree, which would, I suppose, meet a lot of the academic requirements that we have. Does your current employment need to align? Not necessarily. If you can evidence that you have the academic requirements and that you have the interest and experience and the motivation, you know, we would consider, once the academic prerequisites are met, we would consider all applications as long as the application is complete. And we would assess them, you know, equally, and then see how they are ranked overall. So if your work experience doesn't align, I would really recommend getting some experience or getting exposure to dietetics to strengthen your application.
Mm-hmm. And another one, what are the key qualities that you look for in a candidate's application, Sarah?
I suppose an area that you can really demonstrate your knowledge and skills and your interest and motivation is in your CV and your personal statement. So your personal statement is one area that we can see your strength of writing and organization in writing style, but also that you can convey a sense of genuineness and genuine interest in profession. So that can bring a real strength to your application. I know it can be difficult to know where to start with a personal statement, but we would suggest somewhere between 1 and 2 pages, and really structure it well, give examples, you know, be specific. If you have shadowed or have experience in healthcare or shadowed with a dietitian, try to give evidence of that. So it doesn't have to be just 2 references. You could also ask those professionals to write you a letter evidencing that you did what you did, you saying you did in your CV or in your personal statement. Those types of things can really strengthen your application.
Okay, thank you. There's another query in here. What level of maths is required?
So I suppose at a minimum, you would need to have a leaving certificate maths. So that's the Irish secondary school exit exam, or an equivalent from, you know, from another country.
Mm-hmm. Mm-hmm. And maybe just to reiterate then, Sarah, in just the last couple of minutes, what things that potential applicants could be doing now to help with their master's application.
Yeah, so if you find that your current course doesn't meet the prerequisites, you need to, you know, ensure that you take up a physiology or biochemistry module, start talking to people in the field. So you know, set up a meeting with a dietitian. You could attend online webinars and show evidence of that in the area of nutrition and dietetics. There are sort of, you know, and ensure that you're looking at reputable sources, perhaps run by dietitians. There's several more popping up, you know, that are online and that offer continuous professional development type webinars. Try and set up meetings with dietitians. If you feel that you have no exposure, you know, to nutrition or to healthcare, you know, to maybe seek out some volunteering with older people or with, you know, in nursing homes or with Meals on Wheels or things like those types of services that can really enhance your understanding of healthcare settings. And also start talking to the people that you'd like to provide your references to. So, you know, I suppose compiling the evidence that you have with your employers or your academic supervisors to show what you've done with them and how that they can evidence, you know, the skills and knowledge that you do have.
Okay, there's another question in here now. How much do grades for your modules matter if you graduate with a 1st or 2-1? So I suppose, say, for example, if you have done poorly, perhaps, or less well in a 1st year or 2nd year module, but overall you have a 2-1 or a 1st, how?
Yeah, in that instance, that I mean, we do have a kind of a standard scoring system for each of our criterion. So you could, it depends, I suppose, on where in your academic transcripts you're showing deficiencies. But if you come out with a 1st or a 2-1, depending on what the degree is, you could bring yourself up in another area of the assessment criteria, you know, so it wouldn't necessarily, you may still be eligible to be offered a place, but it would be your final score in all of the criteria that would I suppose help with the final decision.
Okay, and then there's one final question in here, which I think you've sort of answered already, Sarah, but maybe just to reiterate it again. And it's really around the number of references. So if you have additional experience about having additional references.
So I suppose the advice is it's really good to have one academic's reference. So someone who knows you in one of your degree programs. And another, if you have, is an employer reference, and that they demonstrate clearly some of the knowledge and skills. So the other pieces of evidence that I've suggested around, if you've done shadowing or work experience, they can be added as well as supporting documents. So it isn't just a max of 2. It's a definite 2 from academic employment type that would meet that, and then additional in terms of evidence to support experience that you have.
Okay, lovely. So can I just finish? It's 6:30 now. Can I just throw it open to Natalie and Porrick to have just one final comment each as for people on the webinar, for potential applicants for the program? Maybe Natalie again first, just throw out what you think.
Yeah, so I found that this program was quite rewarding. It was a great experience. I learned a lot about dietetics and nutrition, and yeah, I would definitely recommend it.
Lovely, thank you. And Porrick,
Yeah.
final word to you.
Yeah, no, the program is brilliant, and you get so much more than just the program when you go to UCD. Like, there's so many clubs and societies as well, and the people that you meet there, and then you come out with a great degree. So yeah, it's all positive.
Excellent. Thank you very much. So thank you all for joining. And I hope that we've answered most of the questions that you had. The recording, as I said, will be up in a few days on the website. So you can look back at it and hopefully you'll find the answers to any of your questions there. And thank you again for joining.